Hello, I'm here to talk a little bit about a very common test that we do in the hospital and the office setting, and it's called echocardiography, or better known as echoes. Echocardiography is the primary non-invasive imaging modality for quantitative and qualitative evaluation of cardiac anatomy, physiology, and function. There are many different types of modalities that we use with echo that we will not be talking about, but to give you an example, there is a so-called two-dimensional or 2D echo, which provides tomographic or thin slice imaging. 3D echo, three-dimensional echo, is another advancement in computers and transducers that offers a significant amount of additional information and frequently used as a complementary tool to the other types of echocardiograms. A comprehensive echocardiogram examination typically involves imaging of the heart from multiple viewing orientations or planes, as well as the use of other imaging technologies. There's M-mode, Doppler, strain, and different other things that we don't need to talk about today. Just to talk a little bit about sound waves. Sound waves are mechanical vibrations that can be described in terms of frequency, measured by hertz, the number of repetitions or cycles per second. Other elements include wavelength, amplitude, not very important, but medical ultrasound imaging typically uses sound waves at frequencies of 1 million to 20 million hertz. In contrast, for reference, human auditory spectrum comprises frequencies between 20 and 20,000 hertz. To put it in simpler ways, think of a bat flying around when trying to understand cardiac ultrasound. A bat is flying around and echolocates by sending out streams of high-pitched sounds through its mouth or nose, in our case, the echocardiogram transducer. By reading these echoes with its supersensitive ears, the bat can then determine the location, the distance, the size, the texture, the speed, and even the shape of the object in question. Because these are registered, they bounce back to the bat's ears, and the bat can determine all those things that it's trying to find out, similar to what we do with echocardiography. So there are three major types of echocardiograms: the transthoracic echocardiogram, or TTE, which is the typical echo that you may have heard of or seen, involving imaging from the chest wall. There's another type, transesophageal echo, or TEE, which is like an upper GI endoscopy, putting a probe into the esophagus and looking from behind of the heart. Stress echo is another test that we do for evaluation of coronary disease, valve disease, before and after exercise. There are numerous advantages of echocardiography that include, first of all, it's a very painless procedure. It can be employed in any setting without patient preparation, discomfort, or inconvenience. It is extremely safe, even in children or pregnant women, and does not have cumulative effects like radiation tests like CAT scans or MRIs. The equipment is very portable. You can see here, perhaps, it's a portable thing that can be moved to the patient's bedside, the intensive care unit. It can be taken to the operating room, where we do some other things there. Clearly, it's a very simple test to do. It takes 15 to 30 minutes to perform a complete exam. Very valuable screening device for early diagnosis, but also very useful for following a certain cardiac condition over an extended period of time. Last but not least, it's a relatively inexpensive test compared to the other high-end technology that we have, MRIs and CAT scans. So what is it useful for? Echo is very useful in the evaluation of many different things. It is very useful in cardiac performance, both at rest and with exercise, like I alluded to with stress echoes. Instrumental tests in the understanding of cardiac structure and function, and this includes better understanding of heart muscle pathology, heart valves, hemodynamics, which is the ability to measure pressures inside the heart. It is also useful in the evaluation of heart infections, we call that vegetations, heart masses, tumors, congenital heart defects, diseases of the pericardium, which is the sac that covers the heart, evaluation of ischemic heart disease or coronary artery disease. It is also an important initial tests. If you have, for example, somebody that you detect a heart murmur, this is the test, the gold standard test to do. Also, like I said, it's a very important test, and it's becoming a standard test for follow-up of many conditions. For example, in oncology, certain chemotherapy drugs are cardiotoxic, so these are very useful for follow-up. Important tool in the operating room, in the cardiac cath lab, in the electrophysiology lab, because it helps guide certain procedures like valve replacements and repairs, placement of devices like Watchman devices that we use for atrial fibrillation. Here at Holy Cross, we have been awarded full accreditation and certification by the Intersocietal Accreditation Commission, IAC, for adult TEE and adult TTE for the last 10 years, which is truly an accomplishment not really available in the majority of hospitals in the area. Why is the accreditation important? That's because it ensures that your echocardiogram will be subject to the highest standards of quality, of completeness, and competency, not only competency by the sonographers, but also by the reading doctor. Finally, last year we inaugurated a spacious dedicated area for non-invasive cardiac imaging. We call it the CIU, that has added efficiency as well as improvement in patient flow. And we're very happy to have this set up here in this hospital. I hope I was able to give you a sense of this important test. There's a lot of technology that we don't need to talk about that involves echocardiograms, but hopefully gives you an appreciation of a test that has become the most important test in many, many patients, and probably after electrocardiograms, the number 2 frequently ordered test in cardiology. Like everything in medicine, of course, we don't recommend this test for everyone, even if it's safe. There are always specific indications to do this test, and we follow guidelines for that. Thank you for your attention.